At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Pain and Pain Management on Wednesday, April 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey, everybody. Welcome to Dr. Tom Roselle Live. And I got a great program for you. It was kind of a continuation of the pattern that we've been on. But you know, the good news is you can actually hear me. The voice is back. Yeah, whatever decided to inhabit my throat was not pretty, but I wasn't sick. I just couldn't talk. Some people said that was a blessing in disguise, but nevertheless, we won't go there, but we'll just let you kind of hang with that. Having said that, we're going to be doing an in-house presentation coming up pretty rapidly now. We're already in April, and it's like, oh my God, it's amazing, right? But we're going to do a program called What Does Pain Have to Do with It? And it's going to be Wednesday at 6 p.m. at the Roselle Center for Healing in Fairfax. I want you to join us. It's going to be, I think it's a program that most people say, well, you know, a little pain, and we take, you know, a few drugs and kind of live with it and so forth. But that's not what the deal is. When you ignore pain, sometimes it can be deadly. When you ignore pain, your life is impaired. When you ignore pain, you cannot continue the process of making yourself better in other areas. It's a devastating situation. So join myself and Dr. Stephanie Pina, who's a doctor in naturopathic medicine, on April the 16th at 6 p.m. at the Roselle Center in Fairfax. All you have to do is go online at rosellecare.com and register for the program that way, or old-fashioned way works too. 703-698-7117. That's 703-698-7117. Make it happen. And well, let's get into the meat and substance, a little bit of what we're doing. And by the way, remember, I want to remind you about something. We are committed to healthcare education. And we have also donated our time through our foundation, Caring for Others, and you can find them online or through our website. And we will make sure that we will be available to you and to your organizations relative to coming out and having one of our doctors talk on any subject at no charge whatsoever. I think the limit is you got to have 10 people there. We'll be happy to do that, whether it's your church group, whether it's your company, whether it's just a group of people that, you know, if you can 10, 15, 20 people come to your house, we'll do that. We'll come in. It'll cost you a cup of tea, you know, maybe some nice green tea, and we'll make that happen. Anyway, call Sybil McFarlane at the Roselle Center, and she'll arrange that. Having said that, let's get into what we're talking about, pain, and pain that you shouldn't ignore. You know, a lot of us just kind of put up with it, right? We put up with different types of discomfort, anything from, you know, severe headaches that are constant, that it's almost like a cascade, and chest pain. And how do you distinguish whether it's your heart or if it's just something that you're not breathing deeply, or you have a nerve that's pinched in your upper back or your neck? How about abdominal pain? How about burning in your feet? You know, that thing that they're calling neuropathy these days? And then the calf, those big calf muscles. Why should you not ignore that? And other types of unexplained, where did they come from, type of pain. So we're going to talk a little bit about that today. We're going to follow it through in the live stream immediately after the program. And all you have to do to find that is go to drtomroselle.com, or as you should, and hopefully you have, follow me on all your social media posts. If you have a social media platform that you look at all the time, we're there. just make sure you follow us, and we'll make sure that you get all the data that we want you to have so you can help yourself and help your families stay well. So let's get into the meat, just a little bit about, what we're really dealing with. What happens if you have a very severe headache? And headaches can be triggered by all kinds of things. You can be too tired, or you have sinus pressure, or, stress builds up. But what we're talking is intense, unrelenting headache. And that could signal something that's quite serious. Could be a brain hemorrhage, a bleed. Yep. There could be a tumor, a space occupying something that's pushing on the tissues of the brain or the outside of the cover of your brain. The dura is what it's called. If you experience these unbearable headaches, you have to make sure that you find out what they are. Don't continue to put up with them. Don't let your doctor put you on opioids to dumb the pain down. You have to make sure that you know what it is that you're dealing with. It's not okay, because it could be something straightforward. In my world, it could be a misalignment of the neck bones of the upper part of your called the cervical spine, and it could be putting pressure on the cord that comes from the brain. It could be putting pressure on nerves that go to the skull area and also into the face, the trigeminal nerve, and you wonder where these things. But it could be traumatic, it could be a blow, it could be a viral pattern, it could be a lot of things, but you need to go to somebody and not just keep consuming the aspirin and the Tylenol, and then the good doctor writes you an opioid prescription. And in today's world, they just keep on dumping that on you. So I want you to make sure you understand that. So we're going to get into that in depth on the 16th. We're going to talk about specifically what these things are, but more importantly, what is the most commonality? And, there's an expression that you've heard me use repetitively over and over again. If you hear hoofbeats, the trampling of the herd, look for horses, not zebras. Look for the things that are the most common, but don't ignore it. Let's talk about your chest and, the chest and neck pain. Discomfort in the chest could be something like pneumonia. It could be a heart attack. It could be a deep heaviness that's causing these symptoms. It could be accompanied by nausea. Now, if that's the case, now you have to start linking other pieces together. What if that chest pain, that neck and jaw pain, the arm pain, the upper abdominal pain just above your stomach, if it's accompanied by nausea, don't dismiss it as simply heartburn. Don't think that it may be, nothing. I just ate something that was wrong. That could be your heart telling you that you got a problem, and if you ignore it, you could be not here with us anymore. So when you have that heaviness, that deep pressure that sometimes will get sharp, and it's accompanied by nausea, and it seems to radiate up into your jaw and into your left shoulder for your guys, particularly ladies, between your shoulder blades. Don't ignore that. Please get yourself to the emergency room like yesterday. Yeah, that's Dr. Tom saying that. If that's not it, if they say, well, now you're okay, don't let them give you medication. Give us a call, because we can fix those things, and we'll show you what it is. Because at that point, it's your diaphragm not expanding, or it's a long nerve called the long thoracic nerve that comes from your neck that goes into that area, or the ribs aren't moving the way they're supposed to. You're not breathing the way you're supposed to. You're courting other types of functional conditions that need to be resolved and dealt with. Now, what happens if you have burning pain in your feet and your legs? Everybody thinks today, oh my God, it's burning, right? Could it be the early signs of peripheral neuropathy? Maybe. It's often associated with diabetes, but it could be associated with other things. Do you know, if you have spinal stenosis, that's where the holes between the two bones in your low back, the vertebrae, or anywhere in your spine, not just in your low back, but we're talking about your feet and your legs. If that area is degenerated, it puts pressure on the nerves that go into your feet. And if it's left untreated, it can worsen over time, particularly with patients who are diabetic. Now, in that situation, and actually in both, if you ignore it too long, you end up with permanency. In diabetes, you lose circulation as well. Although with spinal stenosis, you can indeed begin to lose the the ability of the nerve to be able to regenerate and move forward. Once you have pressure on that nerve and you end up with scar tissue that begins to envelop it, it doesn't take long before you have permanent damage. And literally, a lot of the literature will say anywhere from 24 hours to 72 hours. By the time it hits that 72-hour threshold, there's scarring that in the medical community is considered permanent. We know that with low energy light laser, with ultrasound, with uh, pulsar frequency units and so forth, often much of that can be restored to normal function. It's really interesting, but it's up to you not to ignore it. You can't just say, oh, well, it'll go away. Oh, well, I'm stuck with it, because that, oh, well, is going to get you into a place of irretrievable damage. And unfortunately, so often we're taught that there's things that, can't be done. The calf pain, it could be a sign of something called deep vein thrombosis. And if you have just one area and that's painful, and if it's both, it could be calcium, it could be a magnesium problem, it could be your low back, but it could be a clot that's beginning to move, and it can lead to, yeah, you're being dead type of thing because of an embolism that goes into the lung or into the brain or into the heart. So, persistent calf pain, you have to pay attention. You've got to get evaluated. You have to find out what it is. And then if it's not due to a thrombosis, if it's not an embolytic pattern that's starting, then you can begin to resolve that situation. But you have to know how to do it functionally and not just by giving painkillers and things of that nature. So how about unexplained multiple pains? So here's the deal. This is the interesting puzzle. If you look in the psychiatric literature, indicates depression, can manifest in very physical types of presentations, including pain and so forth. But individuals suffering from depression can report headaches and abdominal pain and limb pain and so forth. But are these things that are being manifested because of the psychological, I don't feel good, and little things become big things? Maybe, but don't suffer in silence when you have any kind of pain. As your emotional state worsens for whatever reason, and there's reasons for that on a neurochemical basis that can be corrected without drugs, by the way, it can significantly impact the quality of your life, making it crucial that you got to be able to seek treatment quickly before it progresses into something that you've got a permanent problem, or unfortunately you may not be here. So we have to look at these things and put them together as a unit, and making sure that we take action the right way accordingly, based on what's really going on, not guesswork, and not just treating the pain. And on the 16th here at the Roselle Center, we're going to do that. I'm really going to open that up for you. I'm going to show you what the situation really is, when to worry, when not to worry. And we're going to let you ask any kind of question that you want. It's important that you become your own advocate, that you know what to ignore, what not to ignore, what to take action on, how you take action on it, and the like. There's so many different types of finger pointers, I call them, signals, right? Dangerous pain patterns maybe you shouldn't ignore, and unfortunately we ignore them. But any kind of persistent headache, any kind of persistent leg pain, any kind of pain in your lower pelvic area, ladies, just above the pubic bone and over to, slightly right and left of center. Guys, you're not immune from this nonsense. We have a tendency, oh, we're men, it's really not a problem, or it'll go away, and how often do we find excuses that says that it's really not a bad thing in our own head, but nevertheless, left unattended over time, can continually cause our body to deteriorate and break down and, go away. It's unfortunate. How about a tooth pain? Yeah, now we're talking about your teeth. How about a toothache, that, just is persistent? It's kind of that dull achy feeling. Let me give you an indicator of tooth pain. If you put cold water in your mouth and you want to, oh my God, that hurts, and you kind of grab your face and so forth, that cold water is triggering an inflammatory something. If you put hot water in your mouth and it hurts like crazy, then you've got what? You've got a bacterial infection, probably of some sort, and it means that there's could be some pus in there and so forth, and it's going to destroy the bone. It can destroy the tooth. It can destroy the root of your tooth unless you take action. In today's world, believe it or not, the old-fashioned let's do a root canal and inject you with whatever we're going to do doesn't necessarily need to happen if you act quickly. There are other things in biological dentistry, and with some great dentists that we do work with, that they will actually inject into the bone near the root in the ozone, and often catch it before that root has completely been decayed and destroyed. And believe it or not, in the world of genetic reconstruction, if you will, they're actually showing how they can now restore a root to a healthy situation. Now, I won't get into details on that. Simply the fact that I know about it doesn't mean I know the intimacies of it, but I'm finding out because I've been reading more and more about it and say, wow, that's a really interesting situation. So don't ignore your teeth. And just remember this piece of when it comes to tooth pain, is that every tooth in your head, in your mouth, has a spinal level, and it has an organ system that it relates to. You can look that up online. It comes, from the world of natural integrative medicine and also from the world of acupuncture. And you're going to see that it's really, really interesting. The back portion of your teeth often relate to the large intestine and the lungs and so forth. And the front part of your teeth, right in the center, can have to do with what? It can have to do with your kidneys, and also has to do with your gonadal function. So if you like reading about things, check it out. See if it correlates to anything that you've got going on. And when you come in on the 16th and you deal with us, I'll probably finger point to that, and I'll tell you a little bit more about it and what it means. And dealing with Dr. Pina, she's great, and how we go through it. So it's an important situation that we look at all the underlying why is that situations. It's going to be really an interesting topic and how we put things together. So join me and let's find out what your pain is all about. Let's see what we can do to help you. Let me tell you something about your teeth, as long as we're on the subject, something that you can do to help yourself if you're beginning to find that you might have a little irritation there. Do this. Start out in the morning and get a cap, just a cap, top of the bottle, cap full of hydrogen peroxide, and mix it with a cap full of water and swish it round and round in your mouth for about a minute. You got infection in there, it's going to bubble up, it's going to foam. And then you're going to spit it out. Don't wash your mouth out. Then take your toothbrush and put baking soda and salt, sea salt or Celtic salt together. Just dampen it. So you're going to put a little bit of sea salt and baking soda, and you're going to use that like your toothpaste. And you're going to wash your teeth that way. You're going to brush your teeth with that combination. And you're going to be surprised how good it is for you. And then after you do that, then obviously wash your mouth out and floss, get the stuff out of your teeth. Now, the next thing you're going to do with that is you're going to take high levels of vitamin C, and because you want to toughen the tissue up. So I would advise get a vitamin C that has bioflavonoids in it. Go to the health food store. Don't go to the drugstore to get it, and ask them for a good broad-based vitamin C and take it a couple times a day. And then you're going to get some calcium, low-level calcium lactate with a little bit of magnesium in it. What do I mean by low level? Probably in the neighborhood of about 200 milligrams to 300 milligrams. And guess what you're going to do? It's a little bitter tasting, but you're going to chew that up, and it'll help tighten and restore your gums and increase your bone density, as long as your hydrochloric acid level in your stomach is adequate and you're doing what you need to get done. So I'm going to give you all kinds of clues when you join us on the 16th. And I'm going to show you exactly what you should avoid and things that will make it worse, as well as things that will make it better. I will give you some home remedies to pay attention to, and then tell you, look, if you have these types of conditions, these are reversible, and this is how you reverse them. You have these types of conditions showing up, please don't ignore them. Make sure you go get something checked out, and you do it like yesterday. And sometimes, even though that your doctor is well-meaning, they'll run a basic blood panel and they'll do a flat EKG. That means you're laid on the table. They just hook up, the electrodes, and they don't find anything. They say, well, there's not a major problem here, but you still have the symptom. Why is that? So if it's not your heart, then maybe we better look at the heart a little differently. Or if it's, we put the heart under stress and it still doesn't show up, then we have to differentiate what the pain is without putting you on so many different types of medications that now you're ending up with another problem because of the side effects of the medication. There was a woman that I was talking to this last week in Italy, and I was there lecturing. I had a great time, by the way. It was really a good time. I was in Naples, Italy, and I was lecturing to 35 osteopathic physicians. Had to use a translator. First time ever. I've never done that before. And it went well. It was good. But anyway, this woman was telling me, and they brought her in because one of the doctors wanted me to use her as a demonstration, that her leg aches and hurts all the time. And she's had all kinds of examinations and tests done and so forth, and there's not anything that was there. And next thing is that they want to inject in her spine. It's called Depomedrol injection, and to see if that will decrease. And I tested her in front of all the doctors that were there, and through testing and through asking her questions, I found two things. One, she was very low in magnesium, and that will cause muscles to cramp at every possible position you can think of. And she was taking a statin, those things that drop cholesterol down. Well, here's this woman, she's 80 years old, and she's on a statin. And at that age, the literature bears out that the greatest majority of people should not be on a statin because it can make things much worse, including showing the symptom process that we're talking about right now. So if that's the case, if that's the issue, then we really need to do something about it. We really need to make a difference in how we approach something. And on the 16th, I'm going to show you what that difference is. I'm going to show you how we deal with certain things and move forward accordingly. It's important that you become your own advocate. Remember, health is a do-it-yourself program. Remember that you're the one that has absolute and total control of your health. So don't let somebody else misguide you. Get the information that you need to have. That's what we're doing at these Wednesday night gatherings on a monthly basis. And we try to make sure that you have the information to say, that doesn't make sense to me, or you know what, maybe we better do a little bit more looking before we decide to say, let's try this. And, how many of you hear your doctors do that all the time? Let's try this. I'm not sure that that's the right approach to take. I'm not sure that I would ever tell you, let's try this. You know what I tell patients when I start seeing them? We put together a lot of information. We go through a process of examination that's much more thorough and depth than most places you'll ever go to. And when we do that, we have a lot of finger pointing, meaning that we could begin to suggest other pieces of the puzzle. We're coming up to the end of the program, and follow me right now on live stream. Go to drtomroselle.com. And remember, I'll be here next Sunday. Why? Because you deserve it, and I love you. See you then. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums.
Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Pain and Pain Management on Wednesday, April 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.